In the previous video, we looked at the relevant anatomy to diffuse axonal injury and quickly viewed the events that occurred during this traumatic event. In this video, we will look at the anatomy relevant to subdural hematomas and quickly talk about the events that occurred during this traumatic event. Let's review the cranial meninges first. The meninges are three membranes that cover and protect the brain. Directly on the surface of the brain is a thin membrane known as the pia mater. Fibers known as trabeculae extend from the pia mater and connect to the arachnoid membrane. Between the pia and the arachnoid layers, cerebral spinal fluid circulates. Tethered to the internal surface of the cranium is a dense fibrous tissue called the dura mater. The dura mater encloses the superior sagittal sinus. Transversing the subarachnoid space are delicate bridging veins which drain venous blood from the brain into the sinus. Acute subdural hematoma occurs when outside forces, such as the impact from a car crash or blunt force trauma, cause the brain to rapidly accelerate and decelerate inside the skull. The brain is not directly attached to the skull. Instead, it freely floats inside the cranial cavity in a bath of cerebral spinal fluid. However, the venous sinuses, which attach to the brain via the bridging veins, are stationary. When a head experiences rapid acceleration-deceleration forces, the heavy, watery brain lags behind the moving skull, which causes stretching of the blood vessels that connect the surface of the brain to the dura. Although the veins have elastic properties enabling them to stretch, they can only be stretched so far before they rupture. When a bridging vein ruptures, it will spill blood into the subdural space. This blood is called a subdural hematoma. The subdural hematoma continues to fill the subdural space with blood based on the rate of bleeding from the ruptured vein. Infants are especially susceptible to subdural hematomas because their bridging veins have very thin walls.